Good morning. I'm assuming today we don't have quorum yet?
Not yet.
Okay.
If we don't have it, when we want to get started, we can move that to the end, the action items to the end.
Who's giving the presentation? The DC?
Chasey and
Oh, I see them.
wait a
Saw
minute.
JC somewhere.
Hi. Yes.
Oh, hi, JC.
Hi.
Chasey.
Hi.
All right, one more minute. Good morning, everyone. All right, so Sade, why don't we, why don't we start? Good morning, everyone. I don't think we have quorum to approve the minutes just yet. So, JC, are you and your team ready for the presentation?
Sure. Yeah.
Great. Are you just you?
Me and I'll be presenting, and then Wayman's also tagging team with me as well.
Great. So would you both like to introduce yourselves?
Sure. Good morning, everyone. My name is Chasey, and I'm the data analyst working in our OECE, or soon to be DEC department's data and evaluation team. Good to see everyone.
Good morning, everybody. My name is Wayman Wong. I'm the manager of the data and evaluation policy and communications work at OECE, and really looking forward to sharing the results of this survey that Chasey's going to be presenting to you today. I'll just be offering color commentary on the side.
All right. Should I share my screen now?
Should be all set.
Okay, great. Thank you.
Maybe I'll just sort of give a brief introduction to the project while Chasey gets the screen share up and running. About a year ago, we felt like as OECE and First Five were going through our strategic planning process and talking to parents through various focus groups that we organized, and also soliciting their feedback and opinions through a previous process that we did with our previous strategic planning consultant. We felt like we were hearing a lot from parents, and we hadn't really heard from parents that we talk a lot about in terms of the city's centralized eligibility list for childcare, that being the Early Learning San Francisco system. There were close to 2,000 families on that list, and we felt like as we were planning, the future of our early learning investments, that it would be useful to hear from folks that had either just joined the list or languished on it for many years, what their needs were, how they had dealt with their needs, given that they hadn't been successful in obtaining a subsidy for their child, finding out, they were on the list to try to get a subsidy for licensed care, but, what were other ways that they, that they would consider meeting their childcare needs. We wanted to find out, how many of them were able to stay home with their kids when they were babies. And so we went out and worked with our evaluation consultant, Clarity Social Research Group, to try to answer a lot of these questions, to learn more about these folks that were on the list. Oftentimes we would just refer to them as, okay, there's 2,000 families on the list. They're all looking for care right now, and we need to do our best to increase the availability of subsidies and access to available spaces. But we don't know a whole lot more about the families themselves. And so we wanted to give the folks on the list a voice in the strategic planning process.
Yeah, thank you, Wayman. Thank you so much for the background of our survey. So let's just dive right in. So we did the survey last December, and we did both online and paper survey, and we got a total of 572 respondents, and we sent out to 1,931. We sent out the surveys to 1,931 families, and we got a total of 572 response.
Casey, can you full screen the presentation so that folks can read it better?
Okay. Oops, hold on one second.
The little icon next to the thing you just dragged.
Here.
Yes.
Okay, hold on one second. Okay, is this better?
Yes.
Okay, so we sent out a total of 1,931 surveys, and the total response rate was about 30%. And as you can see here, we got 52% respondents from Asian, and 30% from Latino, Hispanic, and 8% from Black or African American population. And also here, it shows the parent care preference in terms of the language. So about 42% prefer English, and 37% prefer Cantonese, and 18% prefer Spanish. But this doesn't mean that these are the parents' home language per se. This is their preferred language. All right, so here's a little comparison between the respondents and also to our overall, to the overall population that we survey. And just to point out that from the respondents, there are 52% Asians, but compared to our overall population of the ELSF population, which is 34% for the Asians, it's slightly overrepresented. And also the Latino and Hispanic group, it's slightly underrepresented as well. And the African American group, the Black or African American group, it's also underrepresented. So this group of families are low-income families looking for financial support for childcare. So it's a harder reach group. So given that it was sent out during the holiday or the pandemic, and we're getting 30% of the response rate, which is pretty good. And we're also trying to figure out solutions, how we can also get feedback from the underrepresented group, so then we have a more complete picture of what the parents want in San Francisco. All right, so let's take a look at the overall childcare needs from the parents. And like Wayman mentioned earlier, that we've been under the assumption that there are over 2,000 families waiting on ELSF, and we were thinking that they all need care, immediate care, or need care right away. But the survey told us a different story. There are only 59% of families need immediate care, and there are 41% of families who either don't need care at all at the moment, or they'll need care in the future. And I think a lot of it's because parents are still under the perception of the wait list, that they need to get on sooner so then they can get care the faster, which we all know that's not the case, because it's all based on the availability, the funding at the time.
Recording in progress.
One thing that may also be at work here to a certain degree, although it would maybe show up in the future group, would be parents that are hesitant to have their kids in group settings, lacking a COVID-19 vaccine for that age group. So if we were to do this again, maybe in a year, we might see a slightly different picture.
Yeah. All right. Next, let's talk about the reasons for seeking care. And as we can see that one of the top reasons for parents seeking care is so that they can go to work or go to school. And for this question, parents can choose, can rank their reasons. So then there are a total of 83% of parents say that the top reasons that they're looking for care is so that they can go to school or go to work. But the next top two reasons will be the academic learning and also learning new skill for their children are also important. So it shows that the key takeaway here is that our parents are not just settled for any care. They're also looking for the academic learning and also care for their children learning new skills. So they believe that their children can get these from EC setting. So that's why these are the top three reasons why they're seeking care. All right, next look at the ideal childcare type by child race and ethnicity. And we can see here that the most traditional childcare options that we have will be childcare centers or FCC home setting care, and across the board from all race and ethnicity, parents prefer centers and as well as FCC settings. But you can also see all of these percentage for both center and FCC, they combine more than 100%. It means that a lot of our parents are okay with both settings. And another thing that I want to point out here is the extended leave. And for the Black or African American group, it has 29%, which is about 10% more than the other race and ethnicity group. And we've also heard from our parents focus group that the Black or African American parents think that they're having a hard time finding programs that meet their needs culturally. And this is also why you see a huge difference between the Black or African American group among the others when it comes to extended leave. And also from this graph, we can see that parents not just want to send their kids to a program, either a center or FCCs. And if they were given the option, they also are open to other form of care as well. All right, so now it's the ideal childcare type broken down by child age. And as we can also see, parents want different things as their child grows older. And you can see that the percentage increases for the need of childcare center as the child grows from infant, toddler, and to preschool age. However, for the licensed home setting care type, parents actually prefer that more for their newborns or infants. So it seems to me that parents want different things at different stage when their child at different age. And also, there's a huge group of parents prefer to stay home, especially for their newborns and infant as well. So these are the kind of message or also preference that our low-income families are sharing with us, that if they were given the options, if if money is not an issue, they also prefer to spend more time with their infant or toddler as well. All right, so next let's look at the important features when for parents when seeking for childcare. It's broken down by the race and ethnicity group, and it is very clear that parents prefer respectful and inclusive of different cultures. And we also asked the question, parents are also given the options to choose like whether they prefer the children are the same ethnicity, race and ethnicity with the program, but you can see parents focus more on the inclusiveness rather than the care provider sharing the same race and ethnicity with the family or the children. There are still some, but compared to the respectful and inclusiveness of the different cultures, there's still a big difference. There's a question from the chat. For the preference of site type was asked with understanding money was not an issue. I think it's the ideal. So we asked parents for the ideal situation. So just, and I assume when at the ideal situation, just not thinking about like finding financial support, it's an obstacle or a challenge. I hope that kind of answered the question. All right. And we can also, so another highlight of this graph is that even for the multiracial group, they prefer respectful and inclusiveness of the different cultures. And also a racial ethnicity diversity among the children as well, even given that they're already diverse because they're multiracial family. And Wayman, is there anything else you want to add on this slide? Just in case I didn't miss anything or key.
I would just maybe say that, you know, being able to have language access is, you know, important for families as well, you know, and that's true. Yeah. So, you know, that's also something that was reinforced by the focus groups that we've held over the last year is that, I mean, it's early childhood, it's your ECE program, right? It really is beneficial in terms to the partnership between families and programs when they can communicate well with one another and exchange information about what's going on in the program and what's going on at home in ways that, you know, parents can be supported at home to extend their children's learning and the like. I see Monica has a question.
Yeah, it's not maybe a question so much as a comment. And Chasey, with all due respect, as a mother who raised 3 multiracial, biracial, Black, white children, I want to maybe suggest to you that the multiracial children do not necessarily, in fact, sometimes they even experience more problems than children of one race. So we need to think about that, not just because they're diverse, they don't need diversity. In fact, most of those children struggle with identity just like other children do. And more than ever, they need the respect. And I that doesn't surprise me at all that those were the answers that the parents gave, because many times multiracial children, be that they, you know, biracial, Black, white, Asian, Black, whatever, they are really oftentimes seen as other. And so we need to really wrap our heads around the fact that these kids have a unique place in our system. So I just want to make that comment.
Yeah, thank you, Monica, and thank you for emphasizing that as well. And that's also another key takeaway from this information is that most parents, regardless of their race or ethnicity, or even multiracial, they prefer diversity. Yeah. All right. Thank you.
Can I also say something about the parents that were not as interested in diversity of the staff or the children? I know if the groups that had decided that had been, let's say, white parents, I think we'd be a little bit more concerned about those choices. And I think maybe we should consider the idea that it isn't only about language that makes people make those choices. We have to really recognize that maybe there is a little racism attached to that. I know I've met teachers that are working in centers where the predominant racial group is Asian or Chinese, and the teacher I met was Black and she spoke Chinese and she didn't feel welcome at all. And parents were like, what is she even doing here? And they didn't know that she spoke Chinese. So they were freely speaking in front of her. And I've had, family child care providers at work that didn't want to take in Black children. So I think we have to not ignore the fact that it's not just about language sometimes. Sometimes it's about more than that.
Yeah, thank you so much, Pat. Okay. All right, let's move on. So next is the challenges. And the question was asked parents, please to indicate how much of a challenge each of the following issue is. So cost, it's continued to be the highest challenge among all the parents. And that's no surprise because we survey our low-income families. And these are all the families from our ELSF database. But the next challenge is that took too long of a wait list or availability, and also finding high quality care. So we've heard about this for a long time, that it takes too long and waiting on the wait list for too long, and parents don't necessarily know where programs have spaces, and also finding the high quality childcare. And for the challenge of waiting for too long, and that is the case before, just because funding was also limited, and also especially for parents who are looking for financial support, because funding was limited. So parents are kind of waiting in their terms, but not really how long they're waiting on the list. It was all based on income and eligibility. So there's really no estimate on how long the parents need to wait. So that's why parents have the assumption that they need to apply earlier so then they can get the care sooner. And also availability, it's continued to be the highest challenge for parents. And we're hoping that we can bring that information and also have it more accessible for parents. So then that's one less challenge that the parents need to face. And on this graph, one of the highest challenges is finding high quality childcare. So it also shows that the parents are really value high quality of programs. So those are the things. So the waiting period and the availability, that's something as a DEC department, we're hoping that we can help with that. And also from the parents' voice that they're also looking for high quality program as well. Next. Oops. All right. So next, let's talk about the childcare searching method. And on our resource and referral agencies is the top searching method when it comes to finding childcare or searching for financial support in childcare. But we can also see that for the Black or African American group, Caucasian, Hispanic, Latino, and also multiracial group, that they have a higher percentage on using online care searching websites and also general online search as well. So going to the resource and referral agencies for childcare informations, it's no longer the only option for a lot of our low-income families. We also should consider other options where parents can seek for childcare information and make sure those are accessible for parents in their own language as well. And it is no surprise that our Asian and Latino Hispanic group has fewer percentage in terms of the online search and general online search when it comes to care. It's probably because we don't have good enough translated materials for those group of parents in order to understand how to navigate and get the information, childcare information that they need during their search. All right, next we asked the parents about the parental or family leave. And it's a little bit surprising that about 56% of the families that 56% of our low-income families that did not receive any paid parental or family leave benefits. And it's the same across the board regardless of their monthly income. So, and then among those who used to pay parental leave, only 20% said that the payment was enough to cover their expenses. And here's a little bit more about the parental and family leave. And out of those 56% of parents who did not receive any paid parental leave benefits, there was 62% of them were not eligible. And I think this speaks a lot about the kind of industry that our low-income families are in, the kind of jobs. If they're working in a small company that's not eligible for state parental leave benefits, then most likely that they're not eligible for any of the benefits that they should have as a parent. And it's also true across the board, regardless of the amount of money that they make. They're being not eligible. It's one of the highest reasons why they did not receive the benefit. But also I want to point out that there's 30% of those parents who did not receive the benefits, they didn't know about it at all. So it shows to me that that's another area that we should make sure information is accessible to our low-income families as well.
Tracy, Monica?
Yes.
Monica had her hand.
Could I just ask quickly, of course, I'm assuming this is all sorted for all the parents that are surveyed on this question are employed, is that correct?
No.
So do you see what I'm saying? You left out a significant point here, because they're not eligible could be because they're not working full time, or they're not working. So you have to sort for fully employed individuals versus unemployed individuals, or this doesn't really give us much information.
I see.
Right?
Got it. Yeah.
It could be I'm not eligible because I'm not working, or I'm not eligible because I only work 10 hours a week, or I work, in a domestic job that I'm not paid by an employer. I mean, that's a lot of the case for some of our families. So I just want to point that out.
Yeah, thank you, Monica, for pointing that out. And definitely, this is our first time coordinating and doing such survey, and we're definitely hoping to find out more information about what our parent, like what kind of situation that our low income families are in,
Right.
and what
just
their
wanna-
actual needs are.
Right. I want to make sure that we're not misinterpreting this information,
Yeah,
because many of our families, especially those that are qualified for subsidies, are in such a low income bracket, and because of the fact that they're either unemployed, underemployed, or seeking employment, and that's why they qualify to be in our program. So this could skew this information significantly.
yeah, definitely. Thank you, Monica. There's definitely a lot of good information that we should dive deeper in to understand the whole picture, so then we can make better decisions or for the future. Thank you. All right. So next, we ask parents about the parental leave support expectations, and from the previous seeker, there were 52% said that between $1,000 to $2,000, it's enough to cover their support of caregiving at home. And from the current seekers, there's 30% saying that between $1,000 to $2,000 is enough. So on average, it's between $1,500 for previous seekers and $2,000 for current seekers. So we asked the parents how much, it's like what's the minimum amount of money that they would need per month, so then they can stay home and caring for their children. I see questions. Let me see. Is there a way to find out if those families surveyed were employed or not at the time? Oh, I see. Yes, this is the same thing that Monica brought up. We can definitely check back on the database to see the people who we survey, whether they're looking for care because they need to go back to work or because of other reasons. But they're definitely, we'll try to make sure to look for all the information that we have on the ELSF population to make sure to share a better picture. And I definitely think that it's a valid concern, because we need to know more about those populations. Yes.
One of the tricky things about that is that we asked, some of the parents have been on that list for a long time, right? And their kids have gotten older. We asked about, we asked them to look back basically to the time when their children, were infants. And so their current employment status may be different than, when they just had their baby. So, but, like JC said, we can try to see whether there's some way to retroactively look at that. I understand the point though.
Yeah. And also this is our first time doing this. So moving forward, like Wayman said, we're hoping to hopefully to see this information in the next year or so, and maybe we'll see something different. So this this page, it's about the care experience from the previous seeker. So it means that they are still on the list, but potentially they have an older children that they had the care experience, care search experience before, and they're now still looking for care. So we're asking them for their previous experience as well. And they're about 82% said that their last search of care or early care education program, and they got the care or got their child care situated. And also there's 46% got their child care arrangement in a child care center setting, and 34% at a family child care home setting. But there's still 12% of families end up keeping their child at home And it could be that they value the time that they spend with their infant and toddler. And as you can see from previous graph, that there's still a group of parents who prefer to stay home or have extended leave with their newborn or infant. And we also asked the parents who decide to keep their child at home and what led to the decision. And the top reason was that they could not find a childcare location that was easy for them to get to. So that's another kind of challenge for a lot of the low-income families is the conveniently located program that's available to them. And also 36% of those families could not get a slot that was at a reduced cost. So again, the cost, it's another challenge for our low-income families. And this kind of matches to the previous information that we share about the challenges that our parents are facing. This information is also about the previous seeker as well. And we asked them whether their previous childcare arrangement meet their childcare needs. And 42% said yes, completely. And their 16% said somewhat, and their 7% said no. And also we asked the parents whether their previous childcare arrangement provide any of the following. And the childcare provider had some kind of teaching certificate or degree is the highest, which is 47%. And it seems like that parents are also value the teachers either having a certificate degree or also having the care experience as well. Sorry, let me go back. However, less than half reported that their provider had a teaching certificate or degree that was affordable. So again, we're balancing between the cost of the care and also the credential of teacher's experience and quality of the program. All right, so that's all I have for today, and thank you all so much. Hopefully we're good in time.
I don't know if you saw the question from Rosario.
Okay.
How was the trust question and safety question differentiated? Is the total 18% or is it the same people?
Let me see. The trust question and safety. Let me look back on this slide.
I think it was two slides back from the end.
Let me share it again. Hold on. Which one was it? Sorry, I'm not sure which one was it.
Oh, sorry. I think it was like second or third slide from the end. And it basically, there were two down at the bottom. One of them was about, they had safety concerns about the place, and they also had weren't sure that they could trust that their child would be well cared for. I just wondered how I'm wondering about that group of parents as well as a group of parents who would rather spend time at home. It seems to all be part of a bigger sort of picture, and wondering if there's some way that the group has considered how to address that. Because it seems like some of the questions were very similar, but asked in different ways. So I'm wondering if you saw threads in there that could be addressed by maybe more communication, maybe more parent contact, maybe more time to establish relationships with families. You know, what it is.
I see. I see. Yeah, just given the interest of time, and I don't want to take up like a lot of time of your agenda, and I'll definitely look into our data and our slides, and to your question as well, and I'll share a little bit more either background or more information in a follow-up email, and I'll coordinate that with Sade. Does that work?
Sounds good.
Yeah, I mean, I think for the most part, we've only sort of barely had a chance to digest the data, and we haven't necessarily thought about the program or policy implications of it yet. And that's partly why we're sharing it with you today, is so that you can help us think through, you know, what it all means, and what does it mean for the city's policies and funding and investments, and what does it mean for your own operations. We have another question from Savitha.
Yeah, Savitha, yeah.
Savitha?
Hi, thank you. Would you mind showing me the slide right before the thank you slide? It was something that I was intrigued by, and I wasn't sure if I was reading it wrong.
Is it this one?
Yeah, so the very last one question, did your previous childcare arrangements provide any of the following? It says only the items less than 50% are presented. Were there items that, you know, where the threshold was higher than 50%? I was trying to understand what that note meant.
Oh,
you see where it says
N
is 83, which I'm assuming you had 83 responses. And when you say only items less than 50% are presented, I was wondering what that meant.
It means that the things that were more universally provided weren't included.
What do you have a sense of what were some of the things that were universally provided? I'm trying to understand the context for interpreting these responses.
Right. Why would you do that? Why would you only include the ones that? I don't understand that.
It's just meant to show the things that are potential challenges, or that the parents are running up against in terms of, like,
yeah.
I think I should.
Sure. Yeah, I understand that you're trying to isolate the challenges, but I'm also curious about what are some of the things that are universally present. And I am trying to understand, like, what is the, you know, basically, what are maybe some of the ways in which our childcare system is delivering on, you know, characteristics that parents are looking for. So this is, I'm just trying to get a context for understanding these responses.
I can say that, you know, we did a lot of distillation to get to this presentation.
Sure.
And we do have a full written report that we're happy to share with everybody in the CPAC membership. We just wanted to be able to sort of share the context for the study and some of the key findings before sort of just blasting you all with this big multi-page report. But we will certainly work with Sade to make sure everybody here has access to the full report. And at some point, we will be posting it to the OECE and First Five website, or the DEC website, when it's up and running.
Thank you. And I'm assuming you're going to make these slides available to all of us, because I think I had other sort of detail-oriented questions about the slides that I can email you about and not take up time off of our agenda.
Yeah, we'll work with Sade to make that happen.
Yeah.
Thank you for entertaining my question.
Thank you all so much.
I think that, well, Rosario, do you still have a follow-up question? Your hand is raised.
No, if we get that information, that'll be fine. Because sometimes I think we look for what we're looking for, and we miss opportunities to find out information that's surprising or that's really more authentic from parents. So the full report will be really helpful.
Mario, I know you have a question.
Yeah, there's a question for Wai Ming and the department in terms of what the follow-up will be to these findings, because I actually am not too surprised. This is, as I put in the chat, this is pretty consistent with what we've known. And what I surmise from this data, there continues to be systemic barriers to access to quality care. And that's been a general issue for quite some time. So I'm just wondering, what will the department do? And so obviously, again, it's an ongoing issue. What can we do to sort of improve and eliminate some of these barriers that families are experiencing? Because that's what, being involved with this for several years, I mean, there's nothing here that's surprising or new. And so when you're saying you're analyzing the data, I hope we can get to what are solutions that we can do to eliminate some of these issues that parents are facing.
Yes, thank you, Mario. Wei-Ming, can you, number one, send Sade the slide deck?
Yep.
And I think also we probably will need to follow up and I'm sure there'll be many more questions as we are able to go through the slide deck again and definitely digest all this information. And I believe Monica has another.
Yeah, I'll just make this really quick. Many of us in our own programs, because it's part of our regular best practice, do survey our parents and find out at the end of the school term, what's worked for them, what hasn't. And I think that's also should be part of your mix, which is to allow those of us who are doing the work day to day to let you look at what our data shows us in terms of parent response. I think that should be a part of what is captured and basically sent to DEC to also look at, what parents are saying about care that they receive.
That sounds great.
Great. If I've missed any hands, please unmute yourself and speak up. Otherwise, we will move on to the next item on the agenda. Anybody else? I don't want to cut anybody off. Okay. Thank you, Chasey and Wame, and thank you everybody for your comments. I think that we definitely need to follow up on continue this conversation. Okay, DPH.
Hi there. Hi, everybody. For those that don't know me, my name is Anna Volidzik. I'm here to give you the latest update on COVID-19 with youth and guidance and among youth settings. For those that were in the meeting yesterday, this is the same slide deck. So apologies if I am repeating information, but want to make sure that we share this with everybody. And Julie is bringing up the slides now. Just want to give you status of where we, the focus of the health department and where we are now, especially with respect to young children and toddlers. So as a reminder, our focus for COVID-19 is now on hospitalizations because of all the amazing advancements that we've had in the last couple of years. We're now starting to see a decoupling between the number of cases and the number of hospitalizations. And we're really trying to focus on the most severe outcomes of this disease. So that's where we're focusing. But even with cases, the vast majority of them for children have been really mild or have had no symptoms whatsoever. We thankfully have had minimal pediatric hospitalizations since the start of this pandemic. And even 2 years in, we have had 0 pediatric deaths for those under 18, which is, it is quite a statement. That's not the case for the rest of the country, but that's a testament to the power of vaccines and how many people got vaccinated in San Francisco. So that's a big thank you. But the biggest news is related to vaccines and boosters. There's been a lot of developments recently. So with vaccines and boosters are now free and available to those ages 5 and above. Right now, the only vaccine that is approved for that age group is Pfizer, which is a 2-dose series. However, the FDA is meeting for the next 2 Wednesdays, Wednesday, June 8th and Wednesday, June 15th, to talk about vaccines for under the age of 5. And it will be both Pfizer and Moderna. And it is widely expected, per the safety data that it will meet approval. And the White House issued a statement last week that shots can be in arms for under the age of 5 by June 21st. So I want to talk a little bit more about that in this presentation, but wanted to let you all know. And then particularly for those that are 50 or older or who have immunocompromised systems, they are now can receive a second booster of their choice. And then there is some talk about an annual series that would come online every fall, but we haven't heard any more details for that. So there's a lot of really exciting news when it comes to vaccines and boosters. Also, just in the past few months, we have seen a widespread availability of treatments for COVID-19. You've probably seen in the media a lot of talk about Paxlovid, Evusheld, etc. And this is what's really helped protect the hospital system and prevent the most serious outcomes of this disease for those, especially those that have chosen not to get vaccinated. So that is, you'll see the data and how it reflects both the impact of the vaccines and the treatments in a minute. So we are asking everyone to, clearly this disease is not going to be eliminated and we need to learn how to live with it. So, and balance the benefits and the harms, because we can't continue to do extreme measures like shelter in place. So there's a lot of public health harms to that. So asking everyone to be ready to live with COVID, to have just similar like you have for earthquake preparedness kit, have some tests in your house. The home test kits are now widely available, which was not the case back in January. Have some masks if one chooses to wear them. And the health department's focus will be on equity for those that are most underserved, maintaining the hospital capacity, and preventing the most serious outcomes, which is deaths and serious illness. Next slide, please. So this is a quick snapshot of COVID for where we are right now, both for cases and hospitalizations. And you can see, this was just a couple of days ago, that we are definitely have a rise in cases. It is actually larger than the Delta surge that we experienced last August, but is nowhere near what we went through with Omicron in the winter, and especially in January and February. The orange line is those that are not vaccinated, and the blue dotted line are those that are vaccinated. And you can see that it's a bit of a peak and it's now turning down. And so we hope that trend continues. That has just been the past couple of days, but it does seem like we're past the peak. On the right is hospitalizations, and you can see, unlike previous rise in cases, there's now been a complete, a partial decoupling of the rise in cases from the rise in hospitalizations. So this graph shows a huge rise in hospitalizations in January with a peak of 286. And right now, actually, this morning, it was about 75 hospitalizations in the hospital. It's dropping pretty rapidly in the past couple of days. So this is the power of both the vaccines, the boosters, and now the widespread availability of these treatments so that we can maintain our hospital capacity and then also focus on other public health issues, because there's been a lot of deferred health maintenance during the pandemic with routine healthcare. So we really need to focus on that. So just a snapshot, and then I'm sorry, Julie, next slide, please. Just wanted to talk more about the vaccine eligibility for children under 5. So this would be for ages 6 months to 4 years old. This would be the final age group that would become eligible. There will not be any vaccines available for children under 6 months. That's the earliest they can receive a vaccine. Unlike other efforts, we are really encouraging families to connect with their healthcare provider or their pediatrician for their child. It's just infeasible to set up a mass vaccine site for little babies. We really want them to reconnect to their healthcare providers, especially the big systems like Kaiser and Sutter Health, because there is just a routine process in getting these children vaccinated with their, not only their required vaccines, but then they will have this new product for under 5. We will have a very limited capacity to administer these vaccines at community clinics for those that are not connected to their healthcare provider, but it will be extremely limited, not like you have seen in other efforts. Also, to be aware, the state health regulations only allow pharmacies to administer vaccines for those that are 3 and above. So for all of the other age groups, a lot of families went to Walgreens or CVS to get their vaccines. They can do that for kids that are 3 and above, but anyone under 3, pharmacies are not permitted to vaccinate. So that's another reason why we want families to reconnect to the healthcare provider. And there is documented evidence that many children have fallen behind on their routine required vaccines in order to enter kindergarten. So we are encouraging everybody to reconnect to their healthcare provider to get caught up on all of their vaccines and to get the COVID-19 vaccine at the same time. You can get COVID-19 with other the vaccine with other shots. There's only, I think, the ones that there's a very limited series that cannot be administered at the same time at COVID-19, but that's why it's really important to connect to the to your doctor. And right now our team is working on some outreach materials, not only a slide deck, but a flyer on educating families for about this vaccine, and we will have that available in English, Spanish, and Chinese. We're hoping to have it ready in about a week because we understand that this is moving quick, and we will. I'm sorry, there's a lot of background noise. You wouldn't mind putting yourself on mute. So we are going to ask agencies to help. Help us educate families. We don't have the capacity to host really large town halls like we did with the previous age groups. We have a significant staff reduction. We don't even have the Zoom capability that we used to have. So we were really interested in partnering with your agencies and helping to spread the word, distribute the flyers. If anyone is interested in receiving a copy of the slide deck or presentation. So I'm going to ask Sade to let us know if any agencies are interested in partnering with us and helping to educate families. And we will reach out once we have these materials finalized. Next slide, please. And with that, just letting everybody know, once we move into July, we are, and there's vaccine availability for this age group, we will be retiring quite a bit of our guidance documents and our and any of our documents for schools, childcare, and any other programs for youth. This is a full list of what is being retired. So you can feel free to download this now if you want a copy, because come July 1, these will be removed from our website. But please be aware that obviously these will no longer be updated, and they could be they could be outdated pretty quickly. But we will be pointing to state guidance and letting people know of any updates related to that. And I believe this is our last slide. So I just wanted to pause here and see if anyone has any questions. And thank you for letting me come and speak to you today.
Thanks, Anna. I'm just checking to see if any hands are raised. No, I think it was a perfect presentation. No questions.
I think some people saw it yesterday, so.
Oh, okay. Great. Well, thanks, Anna, for the continued updates. We really appreciate it.
Sure. And please let us know if you would like to partner with us in helping to spread the word on the vaccines for under 5, and then we can reach out separately.
Great. Thank you.
All right. Thank you, everybody.
Great. So next on our agenda is to discuss the mayor's budget. And Naima, you are on. Do you need to share your screen? Oh, you're good. Okay.
Oh, you're muted, Naima.
Do you all see my screen right now?
Yes.
Okay, great. So today we have some updates for you all regarding the mayor's proposed June budget. As I'm sure many of you may know, the budget came out this past Wednesday. And so we thought it would be a great opportunity to update CPAC with where we're at right now and where our priorities still remain. So the first thing is, this is a reminder for folks. This is the budget and how it works. This is an annual process. So in December, the mayor gives out instructions to all departments, including DEC, as well as her, she also shares her 5-year spending plan. And from then, all departments, including DEC, start working on their proposed budget. That then is given, all departments submit that to the mayor in March. And then the mayor takes those budgets as well as her opinions, her priorities for ECE, and she kind of mixes that all together into her proposed June budget. So that is where we're at right now. To remind folks who maybe don't participate in CPAC policy and ledge, something that happens every year is from January to March, and really starting in December, we start meeting as a group bi-weekly to discuss what are CPAC's priorities, what are needs for the community that haven't gotten funded, what are maybe things that are funded but are not working. We start having those policy and budget conversations. I think it's no surprise to anyone here that the last few years have Proposition C, making sure Proposition C stays within the top priorities. And usually we'll have a few add back requests as well. For those who have not participated in the add back process, or maybe it's been a while, every year after the mayor's budget comes out in June, the Board of Supervisors start redlining or penciling out items in the budget that they're like, this doesn't really make sense to fund. This department doesn't need this much money. They could do this in half the money. And from that, a fund starts getting created that we call add back, which is millions of dollars that then needs to be redirected. So every year we try to get some of those redirected funds to go to ECE. And so in addition to our Prop C budget advocacy, CPAC, the SFECE Coalition, Parent Voices, and so many other partners have been advocating for these two asks. One is prenatal care for Black and Pacific Islander teen moms. This would connect Black and Pacific Islander teen moms in their 3rd or 4th trimester with childcare. Likely would be a partnership with Head Start from conversations we've had with Wu Yi. And it would basically ensure that this is one thing you don't have to worry about when you're focusing on school and work, etc. And then the other one is for the CACFP program, which 75% of centers and 44% of FCCs participate in. This provides a very small reimbursement per meal that child care providers are required to provide. And this is a federal program, so we're asking for $1 million for each for the CACFP program. This would go to permanently bring all Tier 2 sites up to Tier 1, and also reimburse closer to the true cost per meal. And for these, I also want to really point out that we asked for non-Prop C funding, especially for the CACFP. We feel like both of these are in the scope of maybe being in Prop C. However, we as a community know that Prop C is not enough money, and something that will be a theme throughout this process is we need to get away from a deficit mindset, a mindset that Prop C is all that we're going to get, all that the community needs. And we're really advocating to say Prop C is just beginning, and Prop C, of course, needs to go to increase educator wages, clear the wait list, and serve families with a higher SMI. And there's not really much money, if any, after that. So we're being really intentional in these asks. And so just an update for everyone, actions taken prior to the mayor's June budget that was released this past Wednesday. We've met with the mayor's office to discuss ECE needs and Proposition C. We did that in April. We met with all board supervisors on our add back ask that was throughout May and June. And Sade did a great job coordinating all of these meetings and getting folks there. And we also met with all 11 BOS members again with the Budget Justice Coalition, and that was really carried by Parent Voices, Maria, as well as Sarah with ECESF. We kind of divide and make maximum impact. And then the next one is attend meetings for our CACFP ask. We're trying to coalition build and make connections outside of ECE because we're stronger together and the more relationships we can build. So we've been meeting for that particular ask with the Food Security Task Force, as well as Shape Up SF, which is also food minded. And then we met with the DCYF director, Maria Sue, just to build relationships, especially after the January we all had, and to also discuss EC updates and needs, because, you know, we do get a little bit of money from the Children's Fund, but that's really been decreasing. So we also want to make sure that DCYF is really up to date with the needs of the ECE community. And so the mayor's budget was released, and last December, she did a children and family recovery plan. And this was a plan that was co-produced by DCYF, but it was really a holistic look at how we're serving children in SF. So that goes all the way from 0 to transitional youth, which is now up to age 25. And from that children and family recovery plan, the mayor has outlined 3 items that are being funded from Proposition C. And this is information that we got last Wednesday. 1, 16 million is going to families with children 0 to 3, up to 200% AMI. Roughly, that will serve 550 families. The second one is for transitional youth with children 0 to 5. So approximately 150 adults will be helped. And this will provide a child care voucher for these youth. So you'll note in the add back ask, we were asking for money for $1 million for a similar program that was targeting Black and Pacific Islander teen parents specifically, but it looks like this investment is going to serve transitional youth from all backgrounds in San Francisco. And then it also looks like 3.5 million to support for parents. Each of the 26 FRCs in the city can add an additional staff member, and then $60 million annually. And this is I'm not going to spend time here. This is the 60 million for benefits that DEC has been presenting on the last few months. So that's what are the key points in the mayor's budget that we really want to discuss. And so moving on, some questions and concerns we have as of today is first, the 3.5 million going to family supports outside of childcare settings, outside of the top Prop C 3 priorities. That's still an issue. We had a huge battle last year, and it's unfortunate that the mayor has not realized that this is the same thing again. So that's something that we need to work on. In addition to that, we also really need to make sure that the mayor does not stop advocating and find a new funding source for the 3.5 million, because that is needed. CPAC is a locally mandated, state mandated body. And, yes, we focus in ECE, but really CPAC locally mandated focuses on all things that impact 0 to 5. So I do think it is appropriate for us to start engaging in that advocacy and finding an appropriate funding source for that. Furthermore, another concern is it seems like because this issue has been brought up twice, 2 years in a row, but furthermore, the issue in January with the proposed ballot measure without talking to DC, anyone in community, no R&R, no educators, like it seems like the mayor just really isn't understanding ECE, Prop C, our intent, and that's something that I think is a lot more clear as after this budget. Another concern, the CACFP add back, we still need to get funding for that. So we'll be continuing to advocate for that for the next month. And then we need clarity around the 4 million for transitional age youth, just making sure that's just going to the childcare piece. And then something else that is new that actually just got on my radar this week is, I guess there was $40 million in ELS baseline funding that was cut for Title V and Head Start sites and SF. So there are some community concerns there. And so I'll just walk through this presentation and we can kind of talk and go back to slides. But this was helpful and shared with me for this last one, the Title V and Head Start cut. So for a Title V and Head Start center, this looks like the current salary structure and model. And so you'll see here, teacher, family advocates, service area managers, upper management. This is kind of like how the salary goes, and it's a slight trend upward as you're in higher management. And this blue line here, this is the current salary coming from ELS. So this is what centers are currently getting, which is about $40 million. And so with the new compensation grants, a part of that 60 million that we're hearing that everyone's talking about, it's going here for teacher increases, which is great. We all support this. This is where the money should be going. The issue that has been raised by centers, however, is that the problem is the 40 million, the blue tier, this blue block right here is now going away. And it's going away because the state is giving an increase to Title V and Head Start centers. However, if agencies are cut locally at the same rate the state increases, sites are at a net zero. There's no new support, and Prop C is meant to be additive to the ECE system, something that grows the system, not something that supplants existing funding or existing programming. So this is the chart that was showed to me that kind of helped me understand what was going on. A question that I think some centers have too is if this blue tier is gone of current non-Prop C funding, this 30 million roughly, where now is this funding going? So I think that's a question that has been asked in CPAC contractors that we're still awaiting an answer from DEC. But I want to pause here because this is a new policy topic for me as of the last 4 days. So I want to make sure pause and let people who maybe are well versed add a few items here.
Go ahead, Monica.
I just want to say thank you so much, Naima, for this great presentation. A group of us in the Title V arena and Head Start as well are working on a survey for those Title V and Head Start contractors to give us data points that help us understand the impact of this blue tier going away and other other compression issues that we're facing with the rollout of the compensation grants. So it's almost final. We've spent, I want to do a shout out. She's not with us today, I don't think, but Johanna from Felton and Ben Wong from Wamay and Jennifer from SOMAC have been working hard with this group of us to put that together. And so when that should be going out to the Title V providers and the Head Start providers within the next, hopefully 24 hours. For those of you on the call or in the group here that are a part of that, we will thank you, and we'll make sure that we can hopefully get that information to be help us to better inform both the department and ourselves about the impact of the current proposal as it sits for the budget. So just to let you know that we're going to be asking for more specific data points from you all in terms of your contracted funding, what you're anticipating, the implications of implementation of the compensation formulas, et cetera, et cetera. So all of this to say, we need your support to get this information to us so we can collate it and put it together in an understandable way to demonstrate for the department what the field is facing with these current issues. Thank you.
Thanks, Monica. So moving on, now that we've kind of talked through our budget concerns, what existing questions we have, we want to bring it back to how it works again. So the second time we're seeing this. So June, we just had it, Mayor released her proposed budget. We have all these concerns we just discussed. So the month of June is the busiest time for San Francisco advocates, which we all are here on this call. At this time, we need to really make sure that they're hearing directly from the ECE community. And that doesn't mean hearing from the same exact 5 people. So because we really have June to make our impact. And then because July, the board amends and approves the budget, but that is, that's really at the administrative level, the board of supervisor level. The community time is in June. The board's not taking meetings in July. That's not how SF works. And then in August, the mayor signs the final budget. So moving on, our next steps, we need to do an aggressive advocacy campaign in June. We honestly do this every year, but I think this year, especially with CPAC's voice growing, and the EC community being more present, we really need to keep it up and show our impact. So alongside already starting our advocacy alongside Budget Justice Coalition, BJC, who CPAC is a member of. Budget Justice Coalition is a coalition of nonprofits in San Francisco that do joint advocacy every year for the budget and add back. And so BJC had a meeting with the mayor's office yesterday. Parent Voices San Francisco, Maria and some parents, Sarah and myself were on to meet with the mayor's office. We discussed our concerns with Prop C regarding the 3.5 million and how we don't want that to come from Prop C, but we also need to make sure that that request is funded. And that's been a long-term request. We need sustainable funding, as well as we asked questions regarding the 2 add back items as well, which we already walked through some of our remaining questions. We need to start doing individual meetings again with all 11 board supervisors. Yes, we just did this, but now with the mayor's budget, we have to go and meet with them again. Also, we didn't realize, the Prop C spending breakdown. So we'll also want to cover that in addition to the 2 add backs. And FRC funding needs. We really want to be intentional and push for that, as well as explain the 40 million ELS cut unless we can get more clarity in the interim. And then a digital campaign. We have the system Salsa Labs. It's, if you get these emails, it's like, click here to email Governor Newsom, click here to email whoever to tell them to take action. We have a digital campaign gearing up to go out on Monday, which will be shared with the CPAC list. and other orgs can have the action link as well. And that will be there will be 2 asks. One will be directed to the mayors. So the EC community will ideally flood the mayor's inbox requesting a meeting with the community after 5 p.m. so educators can attend and have a voice to discuss ECE needs, what Proposition C actually is, and the FRC funding needs as well. And the second action item will be to basically let the BOS know that we're doing that and we're engaged. And then that goes on to the EC community meetings, and we need to turn out in large. And so moving on, the city hosts various ad back days. This is just an FYI for anyone who's interested. Today, Ronan's office is holding a hearing. She's the current budget chair on nonprofit worker wages and the COLA adjustment. The Mayor Breed's proposed budget also included $21 million for a 5.25% cost of living adjustment for nonprofit workers, which is great. And then if people want to call in today, you can voice your support for that, or you can maybe follow along with the HSA Human Services Coalition group ask. And they're saying that while they're thankful for the COLA, that nonprofits need additional resources to address low wages, wage compaction, as well as an additional cost of doing business increase to fully fund rising cost for food, rent, utilities, and operations. So they're asking for more money. So if you're interested in that, that's going on today at 1 p.m. and we can send out that information if folks are interested. The 2 really important dates for us, which Sade will send out an email, are June 16th and June 24th. June 16th is HSA and DEC's budget hearing. So this is the time where everyone within the EC community really needs to come and speak out. The more educators we hear from, the more parents, the better, that are really discussing the needs of the community. We'll send out some talking points. You can use them as a template or you can use them on your own. And we'll also have a sign up link. And that way we can follow up with the right people for calendar reminders and support instead of emailing everyone in CPAC, even if you can't make it. And the same for the SF Public Comment Day. This is overall, this is for everyone who's anyone who lives in SF can call in this day. And it's also really important that we turn out. If you have the question of, I can only make one, which one is more important, June 16th or June 24th? Honestly, they're both equally important. And we need to make sure we're turning out at both, which I know is a lot, but we're really at the point where we need to do that. And these are virtual hearings. However, they will also be in person. So I'm going to go in person. I think Parent Voices and a few other people are going in person. One, because the people who go in person get to speak first, so we don't have to dedicate our whole day to it. And 2, it's good that they see ECE people in person, face to face, when we're asking for money. And then June 27 is just an FYI. That's add back final budget, board deliberations. That's where some advocates will be at City Hall when they're the board supervisors are making their final request and things like that. So with that, with that, that's it. So we can take questions or go back to slides. It probably works if people just unmute themselves.
Maria, did you have a question or a comment?
I have a comment. Yeah, I really have a concern about the mayor's proposed budget because it treats Prop C as a low-hanging fruit. Like, we fought so hard for this money for so many years. ECE couldn't get enough funding, and now we got it, and they're stealing from it. I mean, it's like, that's very strong word, but we're setting a precedent here. For instance, we support the FRCs, but adding a staff, that will be annualized. Last year, or in the last budget, when this was put in, we were told it was one time. Putting a staff is not one time, and this is the second time. So we brought this up at the walkthrough with the mayor's office yesterday at Budget Justice Coalition, and they said they will look at it. But I think we were blindsided here. I mean,
when someone tells us that it's a one-time funding and then the next year puts it back, I really feel like it's not fair. We're being cheated. We support FRCs. Some of my parents have used FRCs, but that should be a children's fund or a first five funding or some other general fund dollars and not baby C. I'm also concerned about, we were kicked out of transitional age by transitional age youth in the children's fund, and now transitional age parents are in the are in Prop C funding again. I mean, and that's up to age 25. How are we sure that this is not childcare setting, by the way? I mean, I'm in favor of providing childcare support for teen moms. Unless this is totally childcare support, I think we need to question this. But that's just me.
Thanks, Maria. Any other comments or questions?
Oh, and by the
Maria.
way, the rally on June 24 starts at 9. And then after that, we go into the public hearing. So if you want to show up and bring the kids, I think if you have kids, they will let you speak first. But we have to make sure that's really gonna happen. In the past, we know that when we brought children, they let us speak first.
Yeah, and just want to make want to make sure that Graham had a comment here that Tay
Okay.
support is childcare. So just so folks have that clarity. Thank you, Naima. That was a great presentation. Just to echo Naima is that, there's 36 of us here. We hope that you'll all show up. We hope that you'll all advocate, be a part of advocating for our children here in San Francisco, and, really looking at what's happening with the mayor's budget, and, coming out and asking the questions. If there's something that you're not understanding or you want to learn more about, please, contact Naima or anybody that's on the public policy committee, but we need everybody's support. So thank you. Okay. I think next we have, well, Sade, do we want to go super quickly with the meeting minutes and the resolution, or do we have quorum?
Yes, we do have quorum.
Okay.
Yes. Okay, so I sent out the meeting minutes for May 2022. Are there any proposed edits, changes to those minutes? If not, can I have a motion to approve the minutes, please?
Okay, I'll motion to approve the May minutes.
And a second?
I'll second.
That was Fonda, Sade.
Oh, Fonda. Thank you. All in favor, raise your. All right, those minutes pass. Next, we have our remote meeting resolution that allows us to meet remotely for the next 30 days. Can I have a motion to approve that?
I'll approve that. A motion to approve the resolution to meet via remote.
And a second, please.
This is Cheryl. I'll second.
Thank you. All in favor, just raise your hands. Thank you. That resolution passes. Thank you.
Great. Thanks, Sade. So next on our list are committee updates. So workforce.
So Workforce Committee is scheduled to meet again on June 21st, the third Tuesday from 2 to 3:30 p.m. We have been giving that space room to talk about the compensation rollout with a lot of focus on the first phase. Last time we met in May, we focused on the second and third phase of the compensation rollout, as well as holding all the questions that are coming up in the community as we work together to try to make this a successful rollout. Really appreciate hearing a little bit more in Naima's presentation about the difficulty with Head Start Title V and looking at the funding switch. And I want to understand that more. So maybe we'll bring some of that discussion there or in our joint policy and ledge. We also had an OST recently hired staff person focusing on the workforce in the OST community out of school time, Brock Hudson, and we were going to reach out to her to hear more about what their plans, and we're also tracking the nonprofit work that was just mentioned that's meeting today at 1 o'clock and looking at compensation across sort of the care and education fields. So June 21st, Tuesday, 2 to 3:30, and as usual, Sade will send an announcement out about that.
Great, thanks, Sarah. Needs assessment?
I got a message that Jenny, you had a comment.
Oh, sorry. I didn't.
Yeah, good morning, everyone. I just wanted to make a comment, and I know that we're heading into a really important period of the city's budget, and the advocacy is being ramped up. I just need to make a comment that with all due respect, I just need to acknowledge how hard the community has fought for Prop C, and I hear loud and clear from the field and members of CPAC, but I just need to acknowledge the characterization of the mayor stealing from Prop C is just really not reflective of the intentions of the mayor and her support for children and families in the city. And again, we will have impassioned discussions over the coming weeks. And again, the acknowledgement of it is legislated. And so we will be clear as a city, as a department, and working with you all in those investments. But I just needed to, just again, acknowledge that as we go into the sprint in this final month.
Thanks, Jenny. Anyone here to give an update on the needs assessment? Okay.
Let me see. I can give an update. I guess Graham and Mona are not here. Okay. Just a brief update. We're working with our consultant. We're doing pretty well. She's been great. And a couple of things. We're still in the data collecting stage, and we are working on cost of care data, school age data. We're going to see if that's something that DCYF is going to present, and we may not include in the needs assessment, but still sort of doing an analysis of that. Working on TK data sorted by zip code and workforce data. And I believe we'll be reaching out to Lisette to work with her on that. The needs assessment is due at the end of the year, so we'll just continue to keep you updated as we move through the process.
Any other committee updates?
I think I have some.
Great.
Mary is on the line. She wanted to talk about the Juneteenth celebration, and I think Dominica is also here to talk about the pipeline program. Is that right? So Mary, did you want to go first? No? There you are.
Okay, so it's gonna be a Juneteenth celebration on Saturday from 2 to 5, and it's gonna be on Ocean between, and we're thanking also the Supervisor Mogar. She's the one that gave the money for the OMI in our area to have the Juneteenth festival. Please come out. It's going to be awesome. There's going to be celebrations, just good times, and it's just to have a good time. no talking. We just talk to each other and have a great time. Just enjoy the time with each other. So please, everyone is welcome to come out. Thank you.
And is there a flyer for that? Or would you mind putting in the chat, just giving me the information on the chat so I make sure I've got it? Right.
I'm not great, but I'll call more recent. Let them send it. Thank you.
Dominica, did you want to share? Yeah.
Yes, I mean, I wasn't prepared to give an update on the pipeline. I'm just here to listen, but thank you for that because I can. So last month I had put into the round table administrator updates that we're having our first like virtual job fair for the first cohort. So this cohort is ending July 31st and we're working with OEWD for placement. So the cohort either needs to be placed at a center to work or open up their own family childcare. And so I had requested that people send over like open job descriptions that they would like me to showcase to my cohort. So if you have open positions, please send them my way because we do have a virtual job fair for the cohort so that they can begin picking and choosing locations where they would like to work. The second cohort is going to begin August 15th. So currently right now we are at capacity with 40 individuals on our list. So we are trying to take in though as many as we can because we were made aware that there are some family childcare providers that do not have the educational units, but they've been given a deadline of 2023 to have the educational units in place if they want to enter into the ELS system. So we are prioritizing family childcare educators who are in this predicament. So if you know any family childcare providers that do need their educational units to enter into ELS that are Black or African American, please send them my way to make sure that they are on for this cohort 2. Are there any questions or concerns?
Thanks, Dominica. And the only other thing was thanks to Monica and Wu Yi and Cheryl, the ACEs screening, the filming is about to start. Did you want to talk about that for a second, Cheryl? Are you there, Cheryl? Maybe not.
Yeah,
Okay.
I see her, but I don't know if she's muted. I hope there she is.
There.
An update on the access tool. So we have been doing the access tool at WE, and we did our first round and there was training provided, and then we're doing our second round to see in June. So it's been a 6-month span.
Cheryl, excuse me, can you quickly, for those people that don't know, what does access mean again? Just make sure.
Sorry. The access tool is the Assessing Classroom Sociocultural Equity Scale, and it was designed by Dr. Stephanie Curitin-Joly at Boston University, and so we had partnered with Pat and the African American Black Child CPAC Ad Hoc Committee to get some people certified in the tool and to do coding. And so we is sort of piloting it, but then San Francisco will have a set of coders in the city so that we can start to actually branch out and code other places as well.
Pat, do you want to add anything to that? Thank you for participating, Pat.
That was, I'm just so thrilled that it's all happening, and I wish I was finished with my certification, but I'm gonna finish. But thank you, Cheryl and Dominica and Mary for your updates. Thank you.
And thank you, Pat. I don't know if it's Fonda's here, if she wants to give an update on the state contractors.
Yes, thank you, Liz. Our state contractors meeting is tomorrow at 3 o'clock, and we will have an update on state contractor information and also continue conversation on concerns regarding the compensation initiative. So we look forward to seeing all of the Title V directors at that meeting. Thank you.
Great, thanks. Have I missed any committees? We had the policy update from Naima in the presentation. Okay.
Is there any update or report out from CAC? Sarah, do you have anything?
Oh, thanks, Shade.
Yeah, I guess I could just say that we're holding some special meetings are being held as the DEC finalizes its strategic plan and shares it publicly. And they held one in May, and we'll have another one on June 22nd, Wednesday at noon. So looking at the strategic plan, reviewing it as a joint body of the commission and the CAC. So that's moving forward. And then the CAC meets again in July 21st.
Great, thanks, Sarah. Okay, well, we have a few more minutes, and I know that there's some updates from community members, and so actually I'm going to turn it over. I know Maria from Recreation and Park has a few updates.
Yeah, hi everyone. Thanks so much for all of your updates. Just reporting out from the San Francisco Children and Nature team, specifically the Early Childhood Working Group, which I know many of you on this call are a part of. We are committed to raising healthy, happy kids through everyday connection with nature. And some of the programs that we have coming up are working with the National Wildlife Federation to do some virtual trainings on how to transform your outdoor play space and how to bring nature programming into the classroom. Potentially it will be a series, but we're going to be starting with one. The tentative date as of now is July 28th in the evening, and we will send out more information as soon as we have it to you all. We're also looking to restart our Nature Play Days. The last time we held Nature Play Days was in 2019, prior to the pandemic. And these are days when we open up a specific park location and host programming with lots of partners for family childcare homes and early childhood centers to come out with their teachers to experience nature programming in the park. We're looking at dates towards the end of August or September. And we'll follow up shortly as soon as we have more information about that as well. But last year, our biggest one hosted about 350 people, including 250 0 to 5 youth that came out. So very excited about being able to relaunch that initiative. And at the same time, through Rec and Park, we continue to partner and work with LIFT to transform some outdoor play spaces in preschools. And yeah. We'll keep sharing more information as we have it, and also highlighting some of the great work that's already happening in the field.
Great, thanks, Maria.
Thank you.
The sun is shining in San Francisco. Get your kids outside. Great, thank you. Oh, Pat, did you want to talk about the FCC conference coming up, like very soon?
Okay, yeah, I was trying to find the link for Monica, but I will find it. Yeah, the conference is coming up in June 24th to the 27th. The Family Child Care Association of San Francisco is hosting the reception. It is like way difficult to try to figure out how to do centerpieces that represent San Francisco for 55 tables. I spend most of my time trying to figure this out, but I'm getting there. So I think it's worth showing up. There's going to be a band. They really wanted a DJ. I really pushed for a band. But I think it's going to be a good chance for San Francisco to really showcase the work we do as a collective to support children in every different delivery system, and that all of us, that all of you support family childcare, which I think is a real testament to the city. So, and that doesn't happen everywhere. So I'm really so thrilled for us to be the host city. I think that's really great. So if you could show up, I'll try to get the link to Sade.
It's there. The link is in the chat, and then Sade will also send it out to the CPAC listserv.
Yeah, thank you.
Any other community updates? Wow. Well, Okay. Well, we finished on time, spot on. Thank you all. This has been great with all this information and hearing from all of you, all the updates, all the great things that's happening in our community. And just want to say that, you know, I truly appreciate being a part of this community, and I thank you all. And we will see you next month. Have a great rest of your day. Take care. Bye.